Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andrew Roark. Guys, I got a fun one today. I am here with Clair Sauer. She is a CVT by training. She is at the University of Penn College of Vet Medicine, and she works in the shelter department over there. Her real passion is in education. It's in teaching and learning. She's got a really cool background. She did a lot of teaching before she came to vet medicine, and she brings that with her. And so I wanted to talk to her about kind of what she sees in education, working in the vet school, and then also what potential she sees for better education for technicians. We talk a little bit about how we can sort of do some educating, maybe more in a more intentional way in the practice. I ask her about the distributive model of training, which is the approach that newer vet schools are leaning towards, where they have students learning out in the wild as opposed to learning on campus in a teaching hospital. We talk a bit about that, and she's got some interesting thoughts as well. So anyway, it's just a cool conversation about vet education and growing people and what the future might look like. So anyway, guys, without further ado, let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Clair Sauer. How are you?
I'm well, thanks, Andy. How are you?
I'm really good. I am so glad to get to sit down with you. This is our first time getting to talk. So we just met. Our mutual good friend, Tasha McNerney, the original anesthesia nerd, was talking to me, and she was like, you've got to talk to Clair. She is doing really, really cool stuff around education, and she knows that that's just a thing that I geek out about is where does the next generation of veterinarians and vet technicians come from? How do we grow people? How do we educate them? How do we set them up for success? And so she just gushed about you, and I went and pulled your bio, and I was looking at your page on LinkedIn and at your Instagram presence, and I was like, oh, wow, I do want to talk to Clair. She's quite interesting. For those who don't know you, you are a CVT. You have a master's in education. You are currently working on a master's in medical education. You are at the University of Pennsylvania's College of Vet Medicine. You're doing training and education there. Let me just stop here for a second and pause. Tell me a little bit about your role at Penn's College of Vet Medicine.
Sure. Right now, I am the lead shelter medicine and mobile unit CVT. So what my job entails is making sure our mobile unit clinics run. They have everything they need. And I help with our SOP design and instructional design for our students that enter those mobile units. The mobile unit is mostly working with our shelter department and our primary care department. It's functioning as a surgical suite. I help run the surgeries that we do on that mobile unit, and I work closely with the shelter med department as well.
So one of the concerns that I hear that comes up with vet student training is surgical experience. So talk to me a little bit more about the program as far as what the experience of the students is. My impression has been that you're providing something here that lets people get real hands-on experience and actually do surgeries and things like that. Tell me more of kind of about what the student experience is like, and then how many students are you able to kind of put through these programs?
So with our program, we do 2 different rotations on our mobile unit. The first is we offer our primary care students from the primary care rotation as a core rotation that the students experience in their clinical time to come on the unit once in their rotation. So they come onto our unit, and we host about 4 students every Tuesday. So we're talking probably 12 to 16, maybe 20 students a month from those rotations are going to come onto our unit. And then we host a shelter med rotation, which is an elective rotation in the school. And with those, we host about 4 students but they come on twice a month. The students, we do about 6 to 8 clinics a month. And each of those can host about 4 students. And we usually have an intern on there as well, one of our rotating interns.
Very nice. I love that you do that. We're recording this in the spring, and you said it's kitten season is getting up and going. And so I think that stuff is so valuable. It's one of those wonderful things. It's good for society. It's good for the pets. It's good for the students. Yeah. And I love that you do that. You have a master's in education. You have a master's that you're working on in medical education. Clair, where did your love of teaching sort of come from, and how did you start to weave that together after you got your CVT?
It starts way back in high school. I was part of a program called Women in Natural Sciences, hosted at the Academy of Natural Sciences here in Philadelphia. It was a program for underprivileged girls to be exposed to different science careers. And through that, I was part of their their veterinary husbandry department. So I got to take care of their animals they use for outreach education and learn all kinds of enrichment and husbandry things with them. I later became a teacher naturalist there, and that kind of just drove me towards being an educator and how much I just love science and I had an affinity for it, especially when it came to environment and behavior and things like that. I was a high school teacher after that, and I loved teaching science. I always had after school programs and always had like classroom animals and things. And then I decided to change because of politics, we'll say, change my career outlook.
Okay.
And I ended up working a lot with my first love, animals. I worked in a physical therapy practice as well as one of the shelters in the area. And it was one of the bigger no-kill shelters in Philadelphia. And I became one of the managers there. And from there, I realized that I was doing a lot of the admin stuff and behavior stuff, but I didn't really have a grasp of the medicine part. So that led me to go to pursue my CVT at Harcum College near Philadelphia here. And the way that I phrased it to them was, what if I taught a class for you in exchange for a class? So you don't have to pay
What?
me. You just have to.
You did a pro bono swap with tech
It wasn't
school?
that detailed, but yeah, I realized that school wasn't really in the cards for me because of finances and where I was in my life and things, and I wouldn't be able to make that commitment. But I was really interested in pursuing the CVT because of the different opportunities it offered from when I was first going to college back in the golden age.
So you are amazing. One of the pieces of career advice that I'd probably give more than any other, just when people ask me, is to try to figure out what you enjoy and what you're good at and try to figure out how to do more of it and figure out what you don't enjoy and what you're not good at and how to do less of that. And it seems like you have consistently tried things and liked parts of them and moved on to other things that were related and liked parts of them. And you've really just made this path happen, which is amazing. How did you come into the University of Pennsylvania's College of Vet Medicine? What was that progression like?
Yeah, so I entered the field I was working, but got my certification at 40. You can do new things, I promise. And I worked for some private specialty hospitals in the area. I did my clinical rotations through my tech school at Penn, so I was familiar with it, but it just wasn't speaking to me at that time. In my clinical practice, I really became engaged in ECC and anesthesia. And during COVID, I did lots of pickup shifts. And my house is very close to Penn, so I started picking up shifts in the ER. And that led to ICU and other departments in the hospital. And I wasn't really a good fit at the hospital I was at. I realized it was a great place, but it wasn't the right place or the right time for me there. And when I reevaluated myself to say, okay, what job opportunity do I want to follow? What is making me the most frustrated about where I am right now? And what is something that lightens me and like just sparks that, ignites that spark in me? And I realized it was the quality of medicine not being compromised and also engaging in learning more in the growth mindset. And so those things I think that Penn really spoke to. And my time there really was.
Nice.
So the respect that, everyone gives each other here is enormous, and there's always potential for learning and growing.
When you look at Penn and you look at how sort of young doctors are being educated there, Claire, what's good? What do we as a profession do well? What do they do at Penn, just from a teaching and learning standpoint?
One thing I've noticed is since they've adapted their new curriculum, they're offering students an earlier kind of step into clinical education. So they're offering more like competency-based education, similar to what human medicine is doing. And they're just giving their new clinicians, one-day clinicians, firsthand exposure to problem solving, to different, I want to say the trick words like competencies and entrustable professional activities, but they're giving them like the opportunity to do the thinking and apply all the things that they're learning. So I think that's an important component of education and what we're trying to encourage in our new doctors and our techs. We're trying to give them firsthand exposure to all of the parts that come together of what they're learning. And I think just learning didactically is a disservice to these folks who are going through these programs because they go out in the world in day one and they don't really have all of those clinical skills kind of meshed into each other. We're not looking at just can you make a diagnosis? We're looking at all of the parts of evaluating the physical exam, every part of it that goes into making that diagnosis, not just the, can you recite this from a textbook?
One of the things I've been really interested in recently is we've got, about a dozen new vet schools that are going to be coming online. And the vast majority of them are using a distributive model for training students, meaning that they're going to have students that are out in clinical practice, sort of getting their hands on. And some of these schools don't have a teaching hospital. Some of them have a very small teaching hospital that's meant to carry a small part of the load and then just send students out and things like that. And I have mixed emotions about it. And so I think that the potential to let students get their get their hands wet in the profession, out in practice, I think that's probably really good. And I do like that. I wonder a little bit about capacity. If you've got 10 new schools that are all using this model and they've got 100 students in each class, I'm like, boy, that's a lot of students. And where are they all going to go? What are your take on this, Claire? So when you look at this and you look at this learning model, it seems to me like you're going to be a pretty big fan of distributive model, but that's not what Penn uses. What do you think?
I also have mixed feelings. I read your blog about this too, Andy, and it was something that I was thinking of a lot because I just had a session with my cohort for my program, and we were talking about things like this too. I think that it's a great way to fill the need that we have in short staffing and being able to have more doctors and more training available. But I think it's a double-edged sword. We're sending folks out into clinics that don't have necessarily a good training model, or folks that were trained to be educators or to be in those roles. So I question what kind of structure do those programs have, and that where you're sending them to a local hospital, I think that's great. They're getting that firsthand exposure, but there may or may not be a standardization to it. So, what kind of competencies are they going to fulfill, and on with what rigor? So we have to look at, are the hospitals going to have a standardized protocol that they follow or not? Are they going to have educators on hand or clinicians from the school that are available to them during their rotations there? And I just am interested about the structure they're going to offer. I think it's a nice solution. It's a solution. It's an option. I think that we're just going to have to wait and see, too, to see how it plays out. But I think better preparing these hospitals for teaching is going to be key to this.
What would you like to see happening in terms of teaching inside of veterinary hospitals for their own staff? Let's say hypothetically that I'm a huge fan of active learning and hands-on learning and, skill building and things like that. And I want to grow, just say my technicians or my associate vets, whatever. And so I'm looking at my own practice and I'm saying, how am I going to grow these people? What does good hands-on training look like? And so, Claire, let me just sort of open that. I know there's not a lot of context around this ask, but what are the things that you see being done in private practice from a teaching, learning, training perspective that you really like?
I think that one thing is you don't have to reinvent the wheel. There's so many different avenues out there that exist that offer these things in great ways. There's private companies, there's consulting firms, there's lots of CE available. So I think the number one is talking to your staff and seeing what their interests are. So where do they want to grow? What do they love? What is their spark? And then finding ways for them to fulfill that spark through CE or through having a pro come in and give some on the floor demonstrations. But you can definitely use what's already out there to enhance it so you don't have to buy all this new equipment. Send them out to a wet lab somewhere, or just really believe in the staff that you have and grow their experience. And I think that will offer so much more than trying to do it all yourself.
I like that a lot. Magic wand, if you get your wish, where do you see the way that we train vet students going in, say, the next 5 years? So let's just take Penn, for example, and say, magic wand pressed into your hand, you, Claire, get to sort of guide this ship. What are the advances that you would like to see? So doing you're in the medical education program that you're in, what do you see in human medicine that we're not using? So anyway, I'm sort of meshing those things together. But yeah, give me your wish list for where you'd like to see training of vet students go.
If we can integrate text into that as well, I think that's a big component that always is through my program I'm taking now. I'm focusing a lot on the vet education, but because I don't have a lot of exposure to the curriculum design and how the vet school works exactly as a tech here so far, I think I want to speak more on the tech in the tech world too, but integrating both of them. So learning as a team And I think increasing the
Yeah.
breadth of both the vet med education, just making it more of substance that people recognize is a thing, that you can be an educator, you can be a clinician that's been trained to be an educator, and having platforms that are based off of education theories, or not so much like theoretical, but practices that we've seen in human medicine and integrating them to what we use in our vet med practices. An example is our curriculums. A lot of the curriculums across the country are now switching to have been over the past like 5 years or so, switching to a competency-based medical education platform. And that is something that we've adapted from human med. And it's shown really working well or decently in the human med realm. So I think it's nice that we have adapted that. And I think, again, we don't have to reinvent the wheel. We can take examples from med ed and integrate our worlds a little bit more. I think I saw that happening a lot more during COVID. So why not continue that and see, what they're working with and what we can adapt from there. And in the nursing, if you look at the nursing world and our tech worlds, maybe look at the education and the standardization of education that the nurses have to gain the respect they have and their title protections and things, and use that in our tech world. And I know there's things in the works right now that are trying to do that for us.
Tell me more about that. What do you mean when you say using their credentialing and sort of standardization for education? What does that look like?
Right now, as we know, in a lot of states, we're working towards passing the VTNE, the boards for vet techs, and coming from an accredited program standardized. There are not that many states left that don't require those things, but it would be nice to then have those accredited programs operating more standardly. Right now, there's a lot of really good things happening in the programs that I don't know all the inner workings of, but having these programs beefed up a little bit so that when I mention that I'm a veterinary technician, people don't think that I restrain and help the doctor with vaccines. They know what's involved in that. If you say you're a human nurse, people know what's involved in that. Providing the education so that people understand what is encompassing our jobs.
Have you looked at all at the curriculum for the mid-level veterinary practitioner, the master's MLVL or MLVP in Colorado?
I want to spend more time looking at them, but maybe you can give me some heads up. From what I've glanced at, I look at what are the things that we as professionals know that a doctor has to do and what we do as techs. And I think the line with that mid-practitioner level becomes fuzzy. And the training behind that person that role becomes fuzzy too. And I think that there's a lot of clarification needed for people to feel more secure with that. I think that it's not something you can just say, okay, Monday they're going to start. I think there's a lot more work that is involved in that, and getting a lot more people involved in the conversation.
Yeah, no, I think you're right. I was just curious if you had insider thoughts about it. To me, I look at it and I don't know what the outcome is supposed to be. So I can't really evaluate the curriculum. Right. What are they going to actually do? And then I would like to take that and then go back at the curriculum and say, this looks like it matches up. It's what I have seen, and again, I'm not an expert on this, but kind of what I've seen, it has seemed a bit light to me in terms of, it's a lot of sort of online education and a fairly minimal amount of sort of clinical hands-on education. And that may be totally fine to come in and do some very specific skills and things that are targeted, and they can 100% build acumen in that amount of time in sort of limited areas. It's not nearly enough to come in and, and take a lot of general wellness work. If this is someone who's going to be doing a lot of things, I don't know that this curriculum doesn't feel beefy enough to me to get people where they need to be, if that's the outcome. But until we know what the position that they're being trained for actually is, I don't know how you really evaluate the education that is sort of being proposed here. So anyway, I was curious if you had more insight than I did.
No, I think I have the same feelings. And I think if you look at it from the human perspective, is we don't allow nurses to be nurse practitioners in the human world until they've had an advanced level of education. So if someone just goes through a basic program, how are we then going to gain respect from the public if we're putting someone into the field to answer their animals' needs after just a basic amount of education? And I love how you went back and said, how can we design the curriculum based on the outcomes? So I think that's something that a lot of people in all of our training forget, is look at your learning objectives. What do you want the outcome to be? And then work backwards from there. And that can go across the board.
I think it's key to education. It's definitely key in training I see that a lot. And again, people have good hearts and they do things for good reasons. And they say, yeah, let's train our staff. And I'll say, train your staff to do what exactly? And they're like, I don't know, just be better generally. And I love where your heart is. It's a really hard way to actually move the needle. And it's option paralysis really, really quick. You're like, we could train on anything. And people go, I have no idea. The more targeted we could be in what improvements we want to make and where we want to help people learn, the better program we can build. Claire, thanks so much for being here. I really appreciate talking to you. I really appreciate you sharing your thoughts and your experiences. Where can people find you online? Where can they sort of follow along with the things that you're doing?
Yeah, sure. I'm on Instagram as the Vet Tech Teacher. I chime in there every so often. It's less so that I've stepped away from my ECC role, but hopefully going to be picking up in some shelter med and some more vet med ed stuff in the future.
Good luck on the rest of your second master's degree and keep doing what you're doing. Anyway, I love having people who are focused on how we grow and train doctors and technicians. So anyway, thanks for what you do. Guys, thanks for tuning in, everybody. Take care of yourselves, gang. We'll see you later.
Bye.
That's what I got. Guys, thanks for being here. Thanks to Claire for being here. If you enjoyed this episode, I'd love it if you left me an honest review wherever you get your podcast. It's kind of how people find the show. It really sort of helps us out. It's a nice pat on the back for me as well. Only if you like the episode. If you didn't like the episode, then maybe don't leave a review. You can just write your thoughts on a note and put it in a drawer. You know, like when you get, I don't know, when someone gives you a sticker that's really cool and you're like, wow, this is cool. It's too cool to just stick on something. I'm going to wait until I find the perfect place. And you put it in a drawer, and then 3 years later you find it and the stickiness is all worn off. Just do that with the letter of things that you don't like about the podcast. Anyway, gang, take care of yourselves, everybody. I'll see you later.